we are going to perform an assessment of a well adult. Okay, I have Michael here that's going to show us how to participate in doing an assessment of a well adult. Okay, first I'm going to start with an examination of the head. I'm going to palpate for any lesions or masses. Any pain in your head?
No.
Any problems with headaches?
No.
Okay. I'm going to take a look at the hair. Make sure there's no rashes, no bumps, no redness excoriation. Okay, and everything looks good. Okay, I'm going to have you look forward. I'm going to start testing your eyes. I'm going to pull your eyelids down. I want to test and see your conjunctiva and make sure they're nice and red. And pink. They should be pink, not real red. Okay, we're going to test your muscular movements of your eye. When you see my hand coming forward, tell me when you can see my hand.
Yeah. 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 Yeah.
Okay, I'm going to have you take a look and follow my pen. I'm going to test your pupil reaction and your eye movements. And follow it back. Okay, good. I'm going to take a look at your ears. I'm going to do some palpating. I'm looking for lesions, any bumps, any pain that you have. I'm going to look behind your earlobe. Do you have any pain in this ear?
No.
I palpate the top of the pinna and the bottom. Looking behind. Pulling my fingers down. I'm going to pull the ear forward, and with my otoscope I'm going to take a look in the ear. Look at the eardrum, make sure I don't find no bulging eardrum, no redness, no swelling of the ear cavity. Everything looks good. Okay, I'm going to take a look at your mouth. I want to look in and make sure there's no redness, no bleeding gums, that you have any problems with your teeth. Do you see your dentist regularly for checkups?
Yes.
Okay, I would like you to open up. I'm going to take a look at all your teeth here. Open up a little wider for me. I'm going to look on the inside of the inner cheek and on the other inner cheek. Make sure there's no rashes, redness, upper lip. And look at the dentition, the gums, lower lip. Okay, I want to make sure, smile for me. We're going to check to make sure everything's aligned with your smile and it's straight. Nice big smile. Okay. I'm going to take a look at your nose. I'm going to palpate the nose. Take a look at my light. Can you come on up for me? I'm going to take a look on the inside. Any bleeding, any lesions, any redness or swelling, any nasal congestion.
No.
Okay, I'm going to go ahead and start palpating your sinuses. Tell me if there's any pressure here or pain.
No.
Any pain or pressure there.
No.
Okay, I'm going to start feeling for lymph nodes. postauricular lymph nodes. Make sure that I can palpate them, that they're movable. The periauricular lymph nodes. Submandibular. Temporomandibular. Supraclavicular lymph nodes. Okay, good. Okay, I'm gonna have you lie down. First, we're gonna take a palpate your carotid arteries. You want to feel that there's no swelling, that I can palpate a pulse in each one. Okay, I'm going to have you turn your head to the side. I want to see if there's any venous distension, jugular venous distension, any swelling in the neck. And turn to the other side. Okay. And then do some palpating of your chest. Okay, I want to listen to the carotid arteries. Listen for any thrills or gruies. Go ahead and turn to the side. And to the other side. I'm going to have you sit up for me. I'm going to palpate your trachea. I want to make sure that it's midline, straight, and I can't palpate no lesions. Okay, next I'm going to palpate the thyroid gland, make sure there's no enlargement, no goiter. I'm going to put my fingers around here. Might be slightly uncomfortable. Go ahead and swallow for me. I want to feel that the swallow is normal. There's no engorgement in the thyroid gland. And there's not. Okay, the next assessment is going to be of your lungs. I'm going to have you, first I'm going to palpate your chest again, and the posterior part of your chest. You tell me if there's any pain anywhere. I'm looking for any abnormalities of the chest. And at the back here. Okay, I'm going to have you lift your shirt up, and I'm going to do some percussion of the chest to make sure I'm hearing the sounds, that there's no chest congestion, no lung abnormalities. It sort of tells me where the lungs end and that they're normal size. Now look up here. listen to your lungs. When you feel my stethoscope touching, if you could take a deep breath for me. Nice inhale, nice exhale. Here, nice freshening of air. Respirations are nice and even, non-labored. Okay, the next thing that we're going to check is your chest expansion. Okay, I need you to take a nice, I want to make sure everything's nice and even as you take a nice inhale and exhale for me. Okay, and turn to the side. All the way to the side. And again, inhale and exhale. Okay, I'm going to have you lie down for me. I'm going to do some palpation around your heart area. Make sure I'm not feeling no thrills, no gallops at Earth's point. Take a listen to with my stethoscope. I'm going to listen with the diaphragm, and I'm also going to listen with the bell. Rhythm's nice and normal. Okay. I'm going to have you sit up for me. I need to look at your eyes one more time. I'm going to shine the light in. I'm going to take a look at the inside of your eyes. Make sure there's no hemorrhaging, no blood vessel distension. I want you to stick out your tongue, open up and say ah. I want to make sure your uvula's in line. I want you to stick out your tongue. I'm going to assess the tongue, the top of it. Hold your tongue back. Open up. Let me test the underside. Stick it out. Bend forward. Bend back. Okay. Okay, I'm going to have you lie back down. I'm going to start palpating your abdomen. Make sure there's no organ enlargement of the liver, the spleen. Any pain
No.
when I'm touching?
No.
Okay, I'm going to take a listen with my stethoscope, make sure I hear some active bowel sounds. It should be nice and loud and normal. Any problems with bowel movements?
No.
Every day normal?
Yes.
I want to assess the umbilicus, make sure there's no protruding lesions, no swelling there. Also, you want to take a look at the femoral lymph nodes or the inguinal lymph nodes and make sure they're palpable. No swelling. Should be mobile. Okay, I'm going to do one more assessment posteriorly on your back. I'm going to have you sit up for me, actually. You know what, that would be better if you would sit up for me. As you feel my hand going across your chest, I need you to say 99 for me.
99. 99. 99. 99. 99. 99.
Any shortness of breath when you're moving
99.
around?
No.
Okay. Everything looks normal there. I'm going to start palpating your arms. Okay, I'm going to test for warmth of both extremities, that they're both warm. I'm going to take a look at your hands. And this way, and this way. Okay, I want to assess the fingernails, that there's no brittle, no breaking, no cracks. I want to test the capillary refill and make sure that it's less than 3 seconds. It shows me that you have good circulation. Okay, the next test we're going to do is going to test your hearing. I'm going to strike my tuning fork. You're going to tell me when you hear the vibration no longer. I'm going to put it at certain points around your ear, okay?
Don't hear it. Don't hear it. Don't hear it.
We're going to do what we call a whisper test right now. I'm going to say a 2-syllable word. You repeat it back to me.
Baseball. Hiccup.
Okay. Alright. I want to take a feel for your pulses. I'm going to feel the radial pulse. I want to make sure that it's nice and even, that I'm able to palpate it, that it would be a 2+ grade, which it is. I'm going to assess your brachial pulse. I'm going to assess your ulnar pulse. Okay, I'm going to test some reflexes in your arm. Tricep muscle. Okay, normal reflex. I want you to hold your arms out to the sides. I'm looking at arm extension. I'm looking that the arms are even. I want you to hold them up high behind your head. Hold them this way, inward. Hold them that way, straight. Any numbness or tingling? Looking for carpal tunnel syndrome?
No.
Okay. I want you to shrug your shoulders up and down. Any pain in the shoulder area?
No.
Any numbness, tingling?
No.
Okay. I'm going to have you lie back down. Okay, I'm going to start palpating the legs. Checking for any lesions, any tumors. I'm looking for rashes. Hold your legs out straight for me, straight towards it. I'm looking for the length, that the lengths of the legs are even, that there's no abnormalities of the bone structure. Okay, I want to have you turn on your belly. I'm going to palpate the backs of the legs. I'm also feeling for warmth, that they're evenly warm. That one extremity is not cold. That may show a sign that there's poor circulation in the leg. Okay, come on back forward on your back. I'm going to test the pulses in your legs and your feet. Your dorsalis pedis pulses should be nice and equal, 2+ grade. Tibial pulses. Okay, I'm going to have you turn back over on your belly. I'm going to feel the pulses behind your knees, the tibial pulses. Okay, come on back forward. Looking for the femoral pulses. Okay, I want you to bend the right leg and pull it forward, holding it up off the bed. Straighten it up. Hold it out to the side. Any pain?
No.
Same thing with this one. Bend it forward towards you, off the bed. Straight up. Hold it to the side. Hold straight. Okay. I'm going to test the reflexes. Can you sit up for me? You want to test your patellar reflexes? Your Achilles tendon reflex? Okay. Next thing, we're going to check your sense of smelling. When I give you something to smell, I want you to tell me what it is while I hold the one nostril closed.
Soap. Perfume.
I want your eyes closed. Tell me what type of sensation you feel on this side
Soft.
and on this side.
Soft. Like rough. The same.
Okay. I want to palpate the temporal artery. Make sure I don't feel no lumps. I feel a pulse evenly on each side. I want the submandibular jaw. Palpate. Open your jaw. Any pain in the jaw?
No.
And close. Okay, I'm going to have you stand up. Eyes closed, arms at your side. Arms out. I'm going to check for any swaying or any loss of balance. Okay, with your arms closed, I want you to take your arms and touch your nose one at a time, going back and forth, finger to nose. Do that about 10 times. Okay, I'm going to have you stand on one leg with your eyes closed. Hop on it. Okay, same thing with the other one. Okay, I want you to take your arms, bend your arms back. Okay, take your arms, put them out to the side for me. I want to check arm extension, make sure arms are even. Okay, I want you to come towards me, and I'm going to go behind you. I want you to bend forward. I'm going to check that there's no scoliosis, no curvature of your spine. So I'm going to palpate the spine coming down. I'm looking for any curvatures, any abnormalities. Any pain while I'm doing this? There's slight curvature of the spine. Okay, I'm going to have you go over to that door for me and look forward straight at me. Go forward to the door. Turn around and look at me. I'm going to have you walk to me, putting one foot in front of the other. Nice and slow. I'm going to test for balance, for gait, steadiness. Okay, I'm going to have you turn around and go back, nice and slowly. Okay, and come back to the bed. We're going to test some sensations in your hands here. Okay. You tell me what you're feeling as I rub it against your hands.
Rough.
Eyes closed.
Rough. Pointy. Pointy. Pointy.
I want to conduct nerve sensation.
It's pointy.
Test nerve sensation. Okay. What are my instruments here? Okay, tell me if you can feel this.
Yes. Yes. Yes.
Okay, hands out, fingers extended. I want to check for finger extension. Bend your fingers back and forth. Any limitations, any pain in your hands while you do that?
No.
Okay, I want you to reach back, hands behind your back. Okay, and forward. Okay, I want you to lie back down. I'm going to take another look at your arms and your legs. I want to make sure there's no swelling, that everything's nice and even. Okay, I'm going to check for edema in the legs. Some slight edema. You need to keep your legs elevated when you're sitting, okay? I'm going to have you sit forward. We're going to test the home inside and make sure there's no blood clots. I want you to extend your leg out. Point your toes to the ceiling. Any pain in the calf?
Well, there's like a stretching feeling, but other than that, no
That's
pain.
normal. Okay, same thing here.
Same thing, just stretching feeling.
Okay.
Okay.
I want you to squeeze my hands
Okay.
as hard as you can. Testing for some strength.
Okay.
Okay. When I push up against your feet, bring your feet up.
Okay.
I want you to push against me. I'm testing your muscle strength of your legs. I want to make sure that it's nice and even. Okay. All right. Okay, we're going to do one more thing, and we're almost finished here. As I push against you, the force against your shoulders, I want you to keep me from pushing you, okay? I'm testing your strength here. Okay, very good. Okay, that completes our assessment of... Okay, we forgot one thing. Okay, go ahead and lay down. Okay, I want you to turn on your side. I want you to bend your leg towards me. And I'm just going to check the function of your leg and back out. Okay, turn on your belly. Left leg up, bend it forward. Same thing with the other leg. Okay, come back this way, towards me. All the way. Okay, same thing with this leg. I want you to bend it up. Okay, any pain or anything in this one?
No.
Okay, I'm going to have you come back. I'll have you sit up. Okay, do you have any questions for me?
No.
Okay. Do you have any concerns or anything about any of your medicines that you take? You should get your annual exam every year to make sure nothing's going wrong. You got some lab work to get done, and follow up with me in the next 3 months. If there's any abnormalities in the lab work, I will give you a call. Okay? and I will see you again in 3 months. Okay?
Okay.
Alright, have a good day. This completes our assessment of the well adult.